First thing you do, even before you get out of the bed, is check your glucose number. Every time I get in the car, the first thing I do is look at my Dexcom, which reads my glucose levels automatically without me pricking my finger to see where I am. Five years ago, I got denied insulin, which is where I found out how to fight insurance companies. It used to be that when you bought insurance, your pharmacy plan and your insurance plan came from the same company at the same policy, so they communicated to each other. Well, now they don't communicate to each other. I was denied insulin, and when I called to fight it, I was immediately told no. Then I found out that my insurance had totally changed.
When you have people restricting their insulin, when you have people withholding their insulin and putting their lives at risk, choosing food over insulin, etc., whatever situation you want to talk about, in this country at this level of wealth is just tragic. Our elected officials are under the influence of lobbyists, and they are under the great influence of the almighty dollar in hopes of getting reelected.
If you need insulin, there's no red insulin and blue insulin, there's insulin. It begs the question, why is it going up? And very often, as we see these prices rise, corporations raise them because they can. But $1 in $4 in our healthcare system is spent on people with diabetes. What does it cost for us not to cap the cost of insulin?
There are options, and it's important for patients to know that there are options, and that step number one is being frank with their provider and letting them know that, look, I cannot afford this medication. What options do we have?
When you integrate specialty pharmacy back into a health system, you see a 13% lower total cost of care. For a lot of these conditions, there are funds available to lower your out-of-pocket expense. It takes a lot of time and resources to check on all of those foundations and financial assistance programs. So most people just don't invest the time to do it.
I found out that none of my supplies were going to be controlled until I met my $5,000 deductible. And then I would have to pay 80% until I met the $10,000 deductible. I was like, this makes no sense.
You have several links in the chain, and the cost of insulin has become so complicated. And frankly, it just simply needs to be disrupted.